Breast augmentation is a common procedure that is done to improve the appearance of the breast. This procedure can help to reshape, lift, and augment the breast to suit individuals' needs and goals. Everyone has heard of the success stories, but is there more to breast augmentation than we should be aware of? Hi, I'm Dr. Timothy Shim, plastic surgeon at Eagle Aesthetics and Surgery. Today, let's talk about what they don't tell you about breast augmentation surgery. Want to hear more from our doctors at Eagle Aesthetics and Surgery? Subscribe to our channel for more insights on the topics ranging from aesthetic medicine to oculoplastic and even plastic surgery. Let's first talk about breast augmentation. The breasts are often a point of contention for women. For some, it may be a case of wanting a fuller and more voluminous chest. Others may want to make small revisions to improve the symmetry and overall satisfaction with their current breasts. For breast augmentation, there are two main options that you can consider. First, using breast implants. The most common form of breast augmentation is the use of breast implants. These can be made out of silicone or saline, depending on the brand of the implant. These implants can have a textured or smooth exterior and can be either round or teardrop or anatomical shaped. These different combinations of factors can help to achieve the specific type of result that you may want. These implants can be placed either above or below the chest muscle, also known as the pectoralis major muscle. So this depends on the current shape of your breast, the thickness of the soft tissue and the breast tissue, as well as whether you're very active and go to the gym to carry a lot of weights. Placement beneath the muscle is a more common approach, and this approach hides the visibility of the breast implant and also reduces the capsular contracture rate. However, sometimes the implant can be placed above the muscle, and this is beneath the breast tissue. This is usually done in patients who are very active, who go to the gym and do a lot of weight training, as the strong compression of the pectoralis major muscle can sometimes compress on the implant if it is placed underneath the muscle. Placing it above the muscle also increases the visibility of the edge of the implant and can sometimes result in a very artificial appearance. However, this can be corrected with a combination procedure using fat graft at the same time. Your plastic surgeon will be able to help you to decide on the appropriate type of implant to be used and also the surgical approach to achieve the ideal result for your unique habitus and condition. Secondly, you can also augment the breast by using fat grafting. For those who want to skip the implants, you can consider fat grafting to the breast. Fat is first harvested from other areas of the body using liposuction and is then processed to concentrate and purify the fat cells and to remove all other impurities. It's then injected, grafted into the chest around the breast tissue to achieve a more natural and voluminous breast shape. Using fat grafting, it may take a few months before you achieve your desired size, as it is possible for the fat that is injected to be reabsorbed into the body, and usually by 2 months you have reached a stable final volume of the augmented breast using fat grafting. So that's what everyone knows about breast augmentation, but is there anything else you should really know about it? Here's what you rarely hear about this common procedure: implant rupture. Once the implant has been inserted, you may think that it is the end of your breast augmentation journey. This is not quite true. As you recover from your surgery, it is important to watch out for any signs of implant rupture. This can happen for a wide variety of reasons, but it is often linked to the age of the implant. The older the implant, the larger the risk of rupture or leaks. Trauma, such as getting into an accident, can also cause implants to rupture. Using saline implants, a rupture will be noticed almost immediately. Once there is a tear, the saline will be extruded from the implant itself and be absorbed by the body. This results in an immediate deflation of the appearance of the breast that has been augmented. In silicone implants, it may take a while for you to notice that it has ruptured. As the silicone gel is thick and is cross-linked, it will remain within the shell for some time before it extrudes out of the shell, and it is not absorbed by the body. Signs that your silicone implant has ruptured include changes in the size and shape of your breast and increasing pain and firmness over a period of time. It can cause what is known as capsular contracture, which is when the scar tissue that is formed around your breast implant becomes hardened, leaving the tissue unusually hard and dense. Your implants will feel that they are being squeezed and move up in your chest. So when a rupture happens, you are advised to remove it as soon as you can to reduce your health risks. Sometimes it is also advised for you to go for breast MRI screenings following your breast augmentation surgery to check for any signs of rupture. Your plastic surgeon will be able to help advise on your next steps if you suspect that you have a ruptured breast implant. Next, implant migration. After breast augmentation surgery, it is possible for your implant to shift and become displaced over time. The various ways this can happen include implants that settle too low or bottoming out. This can happen when the implant slides beneath the bottom fold of the breast. This can happen if too large a pocket is created during surgery for placement of the implant, or too large an implant is used for breast augmentation. Lateral displacement of the implants. This means that the implants have moved outside and settled too far away from each other. This can happen if the pocket of the implants are placed too large or have stretched out over time, creating an unusually large cleavage. Breast implants can also shift towards one another, creating what is known as synesthesia. In some rare cases, the skin and muscle between the breasts detaches and allow the implants to merge. This can happen if the dissection is made too much to the inner side of the breast during surgery. If your implant has migrated, it is possible for your plastic surgeon to make adjustments to repeat the surgery to create a more precise and accurate pocket and help nudge the implants back into the right position. This can be done by tightening or loosening some areas of the capsule and scar tissue that normally forms around the implant. They can also help to advise if it would be better for you to change the type or volume of the implant so as to correct the underlying cause for the breast implant migration itself. Lifespan of breast implants. While breast implants may not expire, they are not made to last forever within the body. On average, the saline or silicone implants can last anywhere from 10 to 15 years, but are often removed before that due to health complications or cosmetic concerns. How do you know that it's time to take your implants out? Your implant may have hardened due to capsular contracture, your implant may have ruptured, or you see rippling, which is unevenness of the skin overlying the implant, and it looks like wrinkles when you look at it or when you touch it, or implant migration, or simply that your implant has already reached the 10 to 15 year mark. So if you are experiencing any of these symptoms, it may be time to replace your breast implants or remove them altogether. Your plastic surgeon will help to advise on the best course of action during your consultation on follow-up with them. Breastfeeding complications. For those who are thinking about motherhood after getting their breast augmentation, I do take note that breastfeeding following breast implants is actually very safe. This is especially even more so if the implants are placed beneath the pectoralis major muscle, far away from the overlying breast tissue. It has been shown from studies after breast augmentation that the amount of silicone that seeps into the breast milk is very, very minimal. So it is indeed safe for you to breastfeed your baby following breast augmentation, and you can feel confident in doing so. And so go ahead and enjoy this special bonding time between mother and baby. If you are interested in breast augmentation, do make sure to do your due diligence and find out everything there is to know about the procedure before you get started. Your plastic surgeon can help to clear up any doubts and point you in the right direction. Do you need a second opinion? Feel free to consult us at Eagle Aesthetics and Surgery to find out more.